Impoverishing health expenditures as a result of high rates of out-of-pocket expenses is a factor of inequality of access to healthcare. People are often forced to forgo medical treatment, and sometimes when they finally seek treatment, it's either too late or complications caused by delay have worsened in their condition, making treatment either more costly or leading to loss of life altogether.
When a family member suffers disease or injury, in many cases, essential resources for living, including food, housing, or sustainable income, are jeopardized. Also, there are many inequalities that prevail in health outcomes. We know, for instance, that HIV and malaria prevalence is 4 times higher than the national average in counties bordering the Lake Victoria. We know that urban areas have substantially higher prevalence of TB than rural areas. And we know that the total insurance coverage in Kenya is 17%, and that is mostly located in the richer families.
In addition, there are stark disparities between rural and urban populations, where rates of coverage are on average between 12% and 27% respectively. Statistics gives us a preview of some of the challenges that we are now working to tackle by being bold, being disruptive, being ambitious in our approach to ensuring UHC becomes a reality for Kenyans.